Outside the box is really uh, an acknowledgement that there are therapy tools and interventions and resources that work and can be effective, even if they have not been well documented, always in scholarship, or even studied as evidence based or evidence informed methodologies. And so, outside the box therapy to me means being creative, being open, being flexible, being able to consider what tools are needed or interventions and resources that you might add to therapy that might not have even been studied or tried with gamblers or individuals or people who are struggling with emotional and behavioral, say, distress, for example. And so I think outside the box as a term really encourages the clinician to not be limited to what has been studied, what has been demonstrated to be helpful and not, and to be free to explore in any given moment with your client what might help your client at this particular time in their life and this particular issue or concerns, and to actually push yourself with the client to consider many options. One of the issues that I have seen in my close to 30 years as a therapist is uh, the fact that we have not been trained to even use outside the box. And in particular, when people leave these programs, they really oftentimes don't even know that they have ethical or professional liberty to consider what culturally diverse communities are already using that work for them. And so outside the box interventions kind of range. When I'm working with clients, I'm asking them to share with me a little bit more about your cultural background, your values, your beliefs, your experiences. How do you view health and healing? Um, how does your community define that? How does your cultural community define that? How do you define it and how do you see it? And to feel comfortable in this space to integrate that. And that's what my goal as a culturally alert gambling counselor and therapist is to explore with the client. And so it varies. So, for example, in the African descent communities, an outside the box therapy, which is really not outside the box to us, but would be considered outside the box for anyone who's not necessarily part of the community, is to use an Afrocentric approach. And what is an Afrocentric approach? An Afrocentric approach places African culture at the center of everything. And so there are other African centered values that are important, such as social consciousness, being connected to the community, having a responsibility for the community. It's not just about me, it's about the people that are in my community. And so I have a social responsibility and I have a social justice responsibility to care for the people that are part of my community. So everything that I do tends to be focused on the community. And so outside the box, if I'm a therapist using an Afrocentric approach, I would be incorporating those African centered values, beliefs, and experiences. So with my gambler, for example, I'm talking to him very openly about how he views himself as a Black man, and the struggle for him as a Black male, and maybe why he got attracted to gambling. And I'm trying to explore where things may have fallen off for him in terms of disconnecting from African culture. I had a Korean client who was struggling with the addictions. And in my own sort of Western healthcare model training, as well as also being assimilated into more of a European American or European descent sort of worldview and methodology, as a clinician, I was encouraging this Korean client who was struggling to share how um, how depressed she was with her husband, who was a pastor, and she didn't feel that the husband was emotionally available. And so in my work with her, I was saying, well, you need to share with your husband just how you feel. It's important for you to be assertive about your emotions, not realizing that in many Asian descent cultures, too much focus on self is actually viewed as immature and is actually not in line with the culture because it's a communal culture and it's a culture that values the group, the family. And so anybody's behavior could actually be hurtful or harmful to the family, to the culture, to the community. And so this particular client taught me a lot in terms of outside the box. First of all, she asked me, she's like, I'm not able to do that. When I encourage her, I wanted to include her husband in the session. I'm not able to tell him how I feel because from her Asian cultural experience, that's not what you really do. And so she asked me if her husband could be in the room, like say, be over here, and if she could have him be over there, and she would be talking to me and sharing her heart with me. She said, can I tell you my heart? And my husband could be in the room and he can hear my heart. Now, of course, in my training, I'm thinking no one ever trained me that you could actually have the family member in the room. Like I know family therapy, but the family member would be basically we're in the dyad, me and the client. The family member is over there on the other side of the room. Again, this was kind of an outside the box approach that the client actually introduced. Can he be in the room? I tell you my heart. He listened to me sharing my heart, and then he'll know my heart. And that I share that experience as an outside the box um, intervention because, again, this was an example of what they don't teach you in our training programs to say, actually, you can make as many modifications as is needed that's going to support the client. And so, the client shared her heart, the husband listened to the heart sharing, and then I debriefed directly with the husband what he heard about the wife's needs and processed that, and then did some psychoeducation about what would be needed for the husband to support the wife. And so it was a different kind of a shift in family therapy when you're working with the family, but it's an example of an outside the box. Other outside the box interventions that I've used is a client comes to a session is in feeling really overwhelmed and stressed, and the client is a runner or is a jogger. And so the session may be for us to actually walk together as the session because I'm seeing that the client is actually really experiencing intense stress, and the way that can translate in terms of blood pressure. The blood pressure is higher, and the client is really struggling with a lot of intensity with gambling issues. And so the session might be more therapeutic if we have the session outdoors in nature. Now, part of that is making sure we check also for certain clients in terms of confidentiality, but I've been able to do that pretty effectively. It depends on where your office is located, or it could be that you even arrange with the client ahead of time to meet in a place where it wouldn't compromise confidentiality of the client, in terms of people knowing that they were seeing a, a counselor. And so even if, say, someone did approach the client, I would tell the client, you can introduce me as whoever you need me to be. They don't need to know who I am, and so whatever you need to say that can get you, to protect your confidentiality, because sometimes that does come up as an issue. Other outside the box interventions that I use is I include a lot of music and the arts into therapy with clients. Sometimes I will actually open a session with a song. I find out what music that the client likes, and it could be that there's some music that's really symbolic with the culture. And so I will sometimes open the session with the song. Sometimes I will introduce music in the interventions by asking the client to bring a song that they can identify that speaks to whatever their struggle is in this current moment or time. Okay, say with the gambling issues, whatever the struggle. And is there a song that really speaks to what your struggle is? And it can also be, is there a song that when you listen to this song helps you? There's a song, for example, that is, I can't remember the author, but it's a song that's a gospel, for example, and it talks about there's beauty in brokenness. I love that song because when I listened to that song as a therapist, and it reminded me that, we don't have to be always together. We're not together people as humans. There's a lot of brokenness in humanity. Things happen to us that we didn't anticipate in life: trauma, loss, grief, tragedy, the crisis of gambling disorders and drug addiction and alcoholism, sex addiction, whatever it is, sexual abuse trauma. Somehow the narrative of the life story got stopped and the plot changed. So I might incorporate music because, like that song, when I play that song, it speaks to there's even beauty in brokenness, and it acknowledges the fact that, we don't always have to be together humans. So I use music as a tool, as a way to elicit for clients. Oftentimes, it can elicit um, emotions and feelings and words that sometimes, because of the crisis of gambling and the other mental health challenges, they just can't formulate the words. Or sometimes it's just you're in such a painful place. The pain is so thick and intense that you don't have the energy to form words. And so when people listen to music, what's wonderful is that the words are being provided for you, and the sounds are very healing for a lot of people. In addition, I would also, as an outside the box, I use art. And so it depends on the person. Not everybody is comfortable with drawing, but particularly with, say, with young clients, I would use art. Or if I found that a client enjoys art, then I would include that as an outside the box. And the reason I share music and arts and sort of creative expressions as an outside the box is because, unfortunately, in most of our training programs, we have not been taught how to use expressive arts as an intervention and as a framework for providing healing. Dr. Alan Ivy, who said, gift every client every time they come. Let me say that again. Gift every client every time they come to therapy. And what that means is that we can't take for granted that a client is going to return to participate in this formal structured therapy and treatment process that has been developed. We cannot guarantee, and that's why in 12-step rooms they say keep coming back at the end of the meeting, keep coming back. And so that's the first statement I want to make. Gift every client. What that means is that we have to work in this session as it could be the last session. Let me say that again. It means we have to work in every session with the assumption that this could be the last session. And what does that mean for us as clinicians? And what does that mean for the client? What that means for me as a clinician is I would like to give this client something that is practical and that is helpful for them today that they can implement right away, that they can start to implement right here in the session, that I'm giving them something, gifting them something that's going to be so helpful that they will be helped and supported in the moment and that they will be able to access and use even after the session. Because if that client doesn't return, I want that client to have something that they can hold on to, that they can utilize, that they can use to breathe through whatever they're facing. So that's the first quote that I love. The second one that I heard that I remember is by Dr. Edwin Nichols. He said, for clinicians, earn the diagnosis. Let me say that again. He said, earn the diagnosis. What Dr. Nichols was saying that I've never forgotten is he said, too often as clinicians, we diagnose so much that's in the treatment plan, but the client lacks the resources really to implement everything that we're diagnosing in the treatment plan and that we want to provide in the treatment process. Let's boil it down. Let's reduce all of these goals and bullet plate, interventions and goals and objectives. And let's collaborate with the client, of course, which should be the focus, and really talk about what they feel that they really can attain and what kinds of support do they need. And let's include outside the box resources and interventions. And so that's the second thing. Probably the most important characteristic that I have seen as a counselor educator and supervisor is if the clinician is flexible. Because if the clinician is flexible, then you can go really far with the client. And this was the one quote that I almost forget, is Dr. Stanley Sue. He said, the question is not how I can help culturally diverse clients or African descent clients or European descent clients or Latinx clients or clients who are gender nonconforming or clients who are women gamblers and clients who are Asian descent or Middle Eastern or whatever it is. The question is, how can I help this particular client? And if this is a client that's African descent, how can I help this African descent client or this European descent client or this female gambler or this client who has gaming issues or this client who is a college student and athlete in gambling or this client who's a Native American from this particular tribe? How can I help this particular client? You don't have to confine and restrict yourself to the models and methodologies that are existing. While those methodologies and scientific models are very important and evidence-based and provides us a lot that will be effective, but we also have to have the flexibility and the ability to move beyond those models, those structures, those systems that don't always help every person. How can counselors develop a network of support that can help them expand their awareness, knowledge, and skills, but also that they can use when it is appropriate to refer to someone else that would be a more cultural fit and match or more effective match for a particular client. And so some things that I do, I think that every clinician should, one, have a supportive network for yourself to identify clinicians, as well as I would include preventionists and public health advocates as well, people who can support you and be available when you have a question, when you're not quite sure. I feel that every agency or every private practitioner should develop a cultural referral list. I also believe that every therapist should have cultural resources, literature, and materials that you have available, that you continue to read and get educated on.